So in this video, I want to show you how we utilize this as a sling to lift a patient off the floor. A lot of times a patient doesn't need a lot of support getting up. They simply can't get off the floor without a little bit of help. And this gives us a viable option to get them up and off the floor safely. In this particular application, we're just going to take the gait belt, we're going to slide it underneath the patient's knees, and we're going to find that center handle and just kind of center it up under them. And we just slide it up underneath their cheeks. You'll notice we don't have to stand the patient up or lift the patient up in order to get this belt under them. On a patient with a little bit longer physiology, the most you would have to do would be to lift the leg just a little bit and slide that up under a cheek to get it positioned properly. Now when we sit Glenn up, he's going to be seated beautifully on this and it'll be positioned properly. When we lift, we're going to come with an up and forward motion. That's Glenn's natural standing motion. We want to keep things as familiar for him and us as possible so that he feels comfortable. We'll select the handle we want to use. Just drop the excess out of the road. And what we're ready to do now is sit Glenn up. Are you ready, Glenn?
Yeah.
Let's just sit you up on that. We're going to block Glenn's feet to keep him from sliding. I've got my outside hand on the sling, and what I want to do is I want to give Glenn something better to hold on to, and I've got to get good control of his upper body. So I'm going to grab behind his arm, he's going to grab behind mine. Now he's got a good secure feeling, and we're going to come up and forward. On your count, Jay.
1, 2, 3.
Can you get your feet under you?
Yeah.
Do you feel pretty stable?
Yeah.
And that's a sling lift.